In support of this motion, Scott Gottlieb. He's a former FDA Deputy Commissioner.
I want to come back to that drug for Hunter's disease, Elaprase, I talked about at the outset. When the data from that study were released, the results were impressive. Patients getting the drug could walk 44 meters farther in 5 minutes than before getting the drug. By comparison, most of the children on the sugar pill showed no improvement, and many saw their condition worsen. Science Daily at the time relayed the experience of 16-year-old Cody Paxton, one of the first patients enrolled in the trial, and he said, quote, "My breathing is better and I'm more energetic," unquote, and he said he could put his hand behind his back, which he couldn't do before receiving Elaprase. Most of the patients forced to take that placebo, however, saw their joint disease worsen and advance, making future treatment much more difficult. I'd like to say that the kids who got the placebo would regain all the function they lost during that trial, but many would not. I'd like to say that companies are still developing drugs for these enzyme disorders, but no new companies have entered this space since that time, and only one subsequent drug has been approved for any of these diseases. And I'd like to say that the FDA reviewer in charge of imposing the Elaprase trial isn't handling drug reviews anymore, but he's actually been promoted and now sets drug review policy for the entire FDA. FDA reviewers are not oblivious to the human costs that we talked about here tonight, but the culture they operate under isn't suited well to minimizing them. By implementing a few key reforms, some of which we've talked about tonight, and modernizing the science of regulation, FDA could modernize its culture and improve its ability to keep Americans both healthy and safe.
Thank you. Scott Gottlieb. Our motion is the FDA's caution is hazardous to our health, and here to summarize his position against the motion, David Challoner. He is Vice President Emeritus for Health Affairs at the University of Florida.
Thank you, John. The conversation tonight is obviously focused very highly on pharmaceuticals and not devices. And I understand the reasons for that. But my comments at this point actually would, I think, in the end, help both processes as long as the FDA was an active, engaged organization. Most voluntary reporting of problems on drugs or devices by patients, the public, the media, health professions, healthcare organizations such as clinics and hospitals, generally first go to industry and then go from industry to the FDA. Legal counsel at many of these organizations are loath to report due to liability concerns for their own client. What does get to industry is supposed to be reported to FDA, but some estimates put the data that FDA receives as reflecting only 1% to 2% of adverse events that actually occur with devices and drugs to the FDA. Moreover, these anecdotes are not informed by any knowledge of the denominator of the report. Absence of evidence is not evidence of absence. Therefore, I would like to say that as things are managed currently, for now, you must reject the premise that the FDA's caution is hazardous to our health.
Thank you, David Challoner. And that's our motion. The FDA's caution is hazardous to our health. And here to summarize his position in support of this motion, Peter Huber. He is a senior fellow at the Manhattan Institute.
In the storm of arguments for and against this motion, I actually believe only one thing, that the best thing for our health is to get the very best drug science we can possibly develop, and the rest will take care of itself. And I've been lamenting, in case you haven't noticed, the FDA's dreadful failure to move molecular medicine systematically into its protocols. And it's had 20 years to do this, and to tell us that they're working on it, it's too late now. When they're done, vote for the other side. But for tonight, vote for our side. But I would like to give you just a taste, which blew my mind when I read this, of the incredible new powers that medicine acquires once it begins doing molecular medicine, from scratch, thinking mechanistically about what drugs actually do. True story, 6-year-old Emily Whitehead was on, and you may have read this in the Times, was on the brink of death after a 2-year battle with leukemia. Her doctors extracted from some of her cancerous cells some signature molecules and moved them into into some of her healthy immune system cells. Exactly as planned, they went into a wild attack on their cancerous siblings, so wild that they overproduced an immune system signaling molecule, a cytokine. One of her doctors knew that an arthritis drug, of all things, controls cytokines. He prescribed a massive dose. Emily, the ICU staff, gathered to sing happy birthday when Emily awoke from her coma on the day she turned 7. The Times ran her story just before Christmas, and Emily is healthy to this day and cancer-free. We should be simply appalled, that intense molecular tracking and learning on the fly and measuring everything you possibly can in sight during clinical trials isn't just the norm today, rather than an exception you have to go through to a special rule to even find. What are we thinking when we tell the doctors, to put on blindfolds and do no adaptation, no significant learning during the trials? The diseases that are probably going to kill you and you and you and me and the people we love are going to require complex arrays of drugs, prescribed in complex ways. We have to do molecular medicine. The FDA isn't
Peter
doing
Huber,
it.
I'm sorry your time is up.
Yes,
Thank you very much.
Thank you.
And that concludes our closing statements. And now it's time to learn which side you feel has argued best, most persuasively. We're going to ask you to go again to the keypads at your seat and look at this motion and vote. The motion is the FDA's caution is hazardous to our health. If you look at that and it rings true for you, push number 1. If you look at it and after hearing everything you don't buy it, push number 2. And if you became or remain undecided, push number 3. You can ignore the other keys, they're not live, and you can correct a key press just by pressing the next one, and it'll work out for you. So we'll have the results in about a minute and a half. But before we get there, a few things I want to say. And the first thing I want to say is I really want to say congratulations to what the debaters did here tonight in a debate where it's... Yeah, it was really clear that this was a debate where there was a very, very deep fault line between these two sides. And yet they came to it with respect. They knew each other's work. They were intelligent, and that's our goal here. So one more time, thanks to all of them for that. And also, I have to say that sometimes it's a little bit tricky with audience questions. Tonight, there wasn't a clunker at all. You were great with the questions, and thank you, everybody who has the courage to get up and ask a question. So congratulations to you. Also, the doctor who brought up the term Big Pharma, I was thinking of setting off this evening with a drinking game every time the words Big Pharma were mentioned. But except for you, we'd be a pretty sober crowd at this point. It didn't happen to come up. We'd love to have you tweet about this debate. Our Twitter handle is @IQ2US. Our hashtag for tonight's debate is FDA. This is the final debate of our spring season. However, on June 19th, we're going to be in Washington, D.C. We're partnering with the McCain Institute for International Leadership. The motion then is this: cutting the Pentagon's budget is a gift to our enemies. I really want you to come down for that. After that, we'll charter a plane to get you down for that. So make sure to visit our website. We're going to be back in the fall, still here at the Kaufman Theater, we're pleased to say. You can see at our website how to buy tickets and what we're doing. We're at www.iq2us.org. But I just want to go through the topics we think we're going to be doing. We're going to be looking at drones. We're going to be looking at breaking up big banks, the case for going vegan. We're going to look at gun control, and we're going to take on immigration. That's what the plan is now. So it's going to be a great fall. We hope you'll all be there. Tickets go on sale in late June, and for more information, you can go to our website and pick up tickets. I've mentioned this already, but for those who can't join our live audience, there are a lot of other ways to see these debates. We stream live on Fora.tv, so everyone who's watching on Fora.tv right now, hi. And you can listen afterwards to this debate on NPR, WNYC here in New York, on PBS stations across the country. That's also Channel 13 here, and check your local listings for air dates and times. All right, so we had you vote twice. On this motion, the FDA's caution is hazardous to our health. After voting twice, according to our rules, the team that has moved the most percentage points to its side will be declared our winner. Here are the results. In the first vote on this motion, the FDA's caution is hazardous to our health, 24% of you agreed with the motion, 32% were against, and 44% were undecided. That's a very big undecided. So those are the first results. Remember, it's the team that's numbers have moved most in terms of percentage points that will be declared our winner. Let's go to the second vote. First, the team arguing for the motion, their second vote is 53%. That's the team that's saying that the FDA is too cautious. They went from 24% to 53%. They picked up 29 percentage points. That's the number to beat. The team against this motion, their first vote was 32%. Their first vote was 32%. Their second vote, 38%. That's up only 6%. It's not enough. The debate goes to the team that was arguing that the FDA's caution is hazardous to our health. Our congratulations to them. Thank you from me, John Donvan. We'll see you next time.